Maybe you were just told that your baby's cord is around its neck and now you are panicking because what are you supposed to do? What does it mean? And how is this going to impact the birth overall? Well, I'm here to put your mind at ease. My name is Liz, I'm a midwife, and I'm going to share with you what it means if a baby's cord is around the neck and what you need to do or know about it. So a cord around the neck is basically what it says. The baby's umbilical cord is wrapped around its neck. It can be one loop or it can be multiple loops. How does it happen? Well, a baby moves in the uterus and they do somersaults and they're just constantly on the move. And in this process, they can have a cord wrapped around an arm, around the body, around the leg or the foot, or around the neck. There's nothing that you can do to prevent this. This is just from the baby moving inside your womb. And what you might not know is that it's actually much more common than people realize. About 20 to 30% of babies are born with a cord around the neck. The majority of the cords are actually quite loose, and then in that case, there's absolutely nothing to worry about. But out of all these babies with a cord around the neck, about 2 to 8 out of every 100 babies have more than one loop. I've seen babies with 3 or 4 loops around their neck, and it can be even more if the baby made a couple of extra somersaults. Am I saying that there's absolutely no risk to it? Well, as much as I would love to say that, nothing can really be 100% when it comes to people's health, because it differs from one person to the next. In general, there's nothing to worry about. A cord around the neck is just that, just a cord around the neck. Is there anything that you can do to prevent it? Absolutely not. Is there anything that you should do while you are pregnant? Absolutely not. You can try and stand on your head and assume all kinds of positions. There's absolutely no scientific evidence to show that certain things that you'll do will unwrap the cord. The most likely situation where the cord will be unwrapped is if the baby did it him or herself. And that's probably not going to happen. And if you go and Google it, you will find people telling you that either a baby of theirs or someone they knew had issues because of the cord, which is why I'm saying it's never 100%, don't worry about it. But when it comes to the risk around it, it's really small. So an umbilical cord is normally around 50-60 centimeters long, so it's quite long. This cord is normally, when it's not wrapped around the neck or anything, long enough that it will still stay attached to the placenta, and the baby can comfortably be born, be outside of the mother's body, and even be put on the mother's chest with the cord still attached. That's why it's long. Now, if it's wrapped around the neck, that length shortens. So where it becomes an issue is if the cord is so short that the baby cannot move through the birth canal. So there's no actual obstruction for the baby's head. Maybe they can fit perfectly, but this cord wrapped around the neck is preventing them to descend. It is not an acute thing if the cord is around the neck. It is more of a gradual thing if it should cause a problem, because if it is around the neck and this labor is not progressing, you might end up with a C-section because of slow progress or no progress during labor. If the cord is wrapped maybe more than once and you are maybe having strong contractions, over time we will be able to pick up on the monitor that traces the baby's heart that something is bothering them and that they're not happy. In those situations, you might end up with an emergency C-section for fetal distress without fully understanding why until the baby is born, and then they might say, oh, you know what, this cord was wrapped quite tightly, maybe that was holding the baby back. If a cord is really tight during a natural birth, and you need to remember here that babies don't breathe in the womb. So we think in terms of being outside the womb. If you have something really tight around your neck, you'll be strangled. But a baby can't be strangled if they don't breathe. They get their blood and their oxygen supply through this umbilical cord. And this cord has 3 blood vessels inside a very thick jelly. It's called Wharton's jelly. And this jelly protects these blood vessels inside the cord. So if it is wrapped around a baby's neck, that jelly is really thick, so it has to be wrapped like super tight for the blood flow from the blood vessels inside this jelly to be pulled so tight that it basically flattens and obstructs the blood flow. That is very rare in those cases. So in those instances, it will be a risk to the baby, but again, we will be able to pick it up during labor, because while a woman is pregnant, there is no traction on the cord. So even if it is around the baby's neck, everything is in one small space. Even if a baby is pulling on the cord, they can't pull it that tight. So in the uterus while you're pregnant, there's no concern. When you give birth with a C-section, there's also not really a concern because they take the baby out within 5 minutes. So if the cord is a problem, they're right there. There's really not actually a risk there. It is only with a normal or vaginal birth where there's traction on the cord as the baby moves through the birth canal. And even in the instances where there's a really tight cord, then there might be a little bit more of a concern, but there are ways to manage it. So most babies who are born with a cord around the neck have a really loose cord, so we literally just slip it over the head, as you can actually see in this video. In the case where the cord is really tight, you can clamp the cord on both sides and cut in between, but that means we cut off the baby's blood supply. Even if the baby is born immediately after that, we want the cord to stay intact because of the benefits of delayed cord clamping. I've got a video about it right here. And this is helping the baby just as they are born to adjust to the outside world in the first couple of minutes. So you don't actually want to cut the cord. So if it is really tight, medical professionals are trained to deliver a baby in a way, it's actually called the somersault maneuver, to help the baby's head stay closer to the mom's perineum while the body is delivered. And then once the baby is out, we can unwrap the cord however many times it is wrapped around the baby's neck. And the only way to diagnose this is via an ultrasound. And just because you've seen it on the ultrasound doesn't mean it is going to stay that way. It can unwrap itself while the baby is continuing to do somersaults in the uterus, but it can also add more loops. So the only time that you'll actually know if it's there or not is during the birth, and if there are any problems, we will be picking it up during labor, and then it will be handled according to protocols. Most of these cords are also not even picked up or diagnosed in pregnancy. So what am I saying at the end of this video? I'm saying it's not something that you should be worried about. You can relax, carry on, and make sure that you have a doctor or a midwife that you trust will know how to handle the situation if there is any problem that arises.